All right, welcome everyone. I'm Steve Krzywicki, CEO and Wealth Advisor with Beacon Bridge Wealth Partners. I want to thank you all for joining us today. I'm excited to be joined by Gary Kasmer, Medicare expert and owner of Kasmer Benefits Consulting. Gary's here to talk about and educate us on a number of decisions that you need to make when you're facing Medicare, turning 65, and really having to make some important decisions. So we're excited for Gary to be joining us today. As you well know, at Beacon Bridge Wealth Partners, we think about your total wellness, which thinks about your finances and how they interact with your healthcare decisions, lifestyle choices, your purpose, and how it impacts your relationships. And I know that one of the biggest questions that clients ask us all the time is around healthcare. When they're deciding to retire, what are my choices going to be? What are the expenses that I should be considering? And what's it going to cover? And Gary's an expert. He's going to help us here today, kind of educate us on some of those decisions. Gary, let's jump right in. Thanks for being here with us. I'm excited to kind of go through some of these really important topics.
Steve, thanks for having me, man. It's truly a pleasure working with you and the team. You guys are great.
We appreciate it, Gary. So tell the people, for those that don't know you, I know some folks may have saw you before, but for those that don't, give a little background on who Gary is and why you're an expert, why this area is so important to you.
Sure thing, Steve. So again, my name's Gary Kasmer. I've been in the industry for 18 years. I worked for a big firm out of the King of Prussia area for a long, long time. I just kind of saw a need and a niche in the small group individual Medicare world. Baby boomers are graduating. What I hear is 10,000 a day. I thought there was some opportunity to help some people and do some good. So I left. I've been on my own. We have a small firm, 3 people here since January 1st, 2020. We help people 3 different ways. We help people before they're 65 with their individual health insurance. We help them through the transition to Medicare and turning 65. And our third way is we help individuals who own small businesses. We navigate all 3, and we really enjoy working in that space.
Yeah, that's great, Gary. Thanks for that background. And let's kind of jump right into Medicare. As I mentioned, it's a topic that many people are asking about. There's a lot of different information that's out there. I know people are getting calls once they are close to 65 and they're not really sure where to turn and what to do. So let's start with the basics. Could you give the folks that are watching today the basics of Medicare, Part A, Part B, supplemental plans, et cetera? Just give everybody a quick rundown of the basics of Medicare.
Sure. The 2 main basics of Medicare is Medicare Part A and Medicare Part B. Medicare Part A, I jokingly say, covers anything when you're in the hospital stuff. Medicare Part A, there is no charge. It's premium free. The caveat there is that either you or your spouse has had to work 40 quarters over your lifetime. If you or your spouse has worked 40 quarters, the Medicare Part A is free. The second part is Medicare Part B. That covers outside of the hospital stuff, doctors, physical therapy, blood work, stuff like that. Anything outside of the hospital, Medicare Part B kicks in. There is a charge for Medicare Part B. The base rate in 2023 was $164.90. In 2024, that is going up to $174.70. Okay, that is the base rate. Now, Medicare and Social Security, in all their wisdom, how they determine what your Medicare Part B cost, they look back 2 years. So in 2024, they're going to look at your 2022 tax return, and they're going to determine what your Medicare Part B cost is. The base rate is $174.70, and that can scale all the way up to $594 a month each. Okay, Steve and I can share the tables and how the different rates happen, but this is one of the areas where Steve and the team with tax planning can really help you out. Again, it's a 2-year look back, $174.70. Now, those 2 parts of Medicare Part A and Part B, they cover roughly 80% of your health care. Okay. Where folks like me come in is we try to fill in the other 20%. There's a couple different ways, and we can dive into them. Basically, the first way, and many of our clients have this, it's original Medicare, Medicare Part A and Part B, with a Medigap or Medicare supplement plan and a prescription drug plan. Okay. Why people have that is they have that because it gives them the ultimate freedom. There's no referrals, there's no networks. Okay. They can go anywhere in the country with a Medigap plan. All right. What's the downside, if there was a downside to such a thing? Okay. The downside is that it costs some money. $150 a month for a supplement plan, $32 a month for a prescription drug plan, but you get ultimate freedom and you get very little out-of-pocket costs. Steve and I will address later the different plans, okay, that you can choose. And then the other hand is a growing part of the market that's called Medicare Advantage. Okay, that's everything that you see on TV. That's the mail you get, probably the phone calls that you're getting. What that is, it's managed care. You sign up with a carrier. You have to play by their rules. You stay within their network. A lot of the times you don't need referrals. And a lot of the times you can go anywhere in the United States. Okay. But you do have to play by the carrier's rules. Most of the plans include medical, dental, vision, prescription drug. I jokingly say the kitchen sink. Everything is included in these Medicare Advantage plans. And what has happened over the past couple of years, and I know it's hard to believe, is a lot of these plans have become premium free. So literally $0 a month. Okay. So Steve, I may have went on a little tangent there, but Medicare Part A and Part B, and your two ways how you can fill in the gaps.
So let's talk a little bit about cost, Gary. You started to kind of open that door a little bit. So let's just spend a couple of minutes there. For supplement plans and out-of-pocket expenses, what kind of costs? You mentioned $150 a month and $32 for, and I know these are kind of estimates, but are there other expenses for a supplement plan, like out-of-pocket? There used to be the whole donut hole conversation and things along those lines. What other expenses, if any, would people be needing to plan for there?
So when you get a Medicare supplement plan, Steve, you are paying a monthly premium. But the beauty of these plans is that you have very little out-of-pocket exposure. Now, there's two popular plans. One's called a Plan G and another one's called a Plan N. If you have a Plan G, you have 100% hospital coverage. So God forbid if you wind up in the hospital, you wouldn't pay one penny out of your pocket. With Plan G, anything outside of the hospital, you have a $240 deductible, and then the plan pays 100% the rest of the calendar year. So why people go to a Medigap Plan G? Very little out-of-pocket exposure. The next plan is called a Plan N, Steve, and that acts the same way, okay? The difference being is after you pay that $240 out of your pocket deductible, okay, you would have a $50 emergency room copay or a $20 doctor copay. So whether it's your primary, your specialist, what have you, okay? Plan N, you have those two deductibles. Those two copays after you meet that deductible. Why do people go to Plan N? It's kind of like the up and coming plan. It's a little cheaper, and I think it probably has more legs as we move forward.
Got it. So, I mean, is it fair to say that, each of these plans are similar, but slightly different, right? And it really depends on, I guess, a cost benefit analysis is what it sounds like, right? Like what type of health issues you may have, what type of coverage you feel like you may or may not need. Is that really the types of conversations that you're walking through? I mean, what's a typical conversation look like around that?
All day, Steve. I mean, we look at we do the financial analysis of it. And, I always say to my clients, it's really hard. You don't have a crystal ball. It's hard to look in the future and see what's going to happen. You can look backwards a little bit and look at your health history. Maybe you're more comfortable with a Plan G or maybe you're really, really healthy and the Plan N would work for you. We have those conversations. They're not always easy, but eventually we figure it out.
If you were to pick a plan G, and then want to switch later on, how easy is that?
So after your initial enrollment period, when you first join a Medicare supplement plan, it's roughly 12 months that you can kind of maneuver in and out of a plan. Okay. After 12 months, you have to answer detailed medical questions to switch plans. Okay. Even within the same carrier. So for example, Steve, if a client started out with a AARP Medicare Supplement Plan G and called us up 2 years down the road and said, I'm not really using it. I want to go to a plan N. Okay. At that point, even within the same carrier, Steve, you would have to answer detailed medical questions. So I always say that, when you pick a supplement plan, in a lot of ways, you marry that plan. You're probably going to be with it for a while.
Got it. Got it. So it's really important to really vet these things out early on, and really understand. I'm going to get into timeframes in a second of kind of when you have to start making these decisions. Before I do that, though, I just want to take a minute and talk about prescription plans, because these are, important as well, right? This is another part of the decision making. I think there is a little bit more flexibility, there. But talk about prescription plans, what options that are out there, how do people make those decisions, and how often are they able to change those decisions?
Yep. So prescription drug plans, otherwise known as Part D, Steve, there's literally hundreds of them on the open market. I have a colleague here who specializes in the prescription drug plans. What we do is we take an inventory of your current medications, the name and dosage. We plug them into the system, and we look for the best plan that was going to work for you. What drugstore do you like going to? Are you willing to do mail order? Two people could live in the same household, wife, husband, have totally different drug needs, and they could have different drug plans. That's also something, Steve, unlike the supplement plans where I say that you marry those plans every year, with your drug plans, you just date those, because every year at open enrollment, you can change your drug plan. So as your drug needs change, so can your drug plan.
Okay, a lot more flexible than the supplemental plans.
Definitely.
Got it. Got it. All right. So give me a sense of timeframes. I think most people know that you're eligible for Medicare once you turn 65. But what are the key timeframes about when should someone start evaluating their choices? When can they apply? What's the window for enrollment? Talk a little bit about those key timeframes.
There's a couple different areas there, Steve. So the first one, if you're turning 65, there you have a 7-month window, okay, to enroll in Medicare. That's 3 months before the month of your birth, the month of your birth, and 3 months after. Okay, you can enroll anytime during that time frame. If you enroll 3 months before your month of your birth, it will all go into effect the first of the month that you turn 65. Okay. Afterwards, you can pick a day when you want that to go into effect. Now, that's for people that maybe they have coverage right now. They just want to know what the options are. There's another window out there, and this is a lot of our clients, Steve. They're 66 or 67, and they're still working, and they're starting to explore, what Medicare looks like. Once they stop working, there is an 8-month window for them to enroll in Medicare Part A and Part B. Okay. So 8 months from the time they stop working, they have that window to enroll in Medicare. And it's called a special enrollment period. There's a couple forms that people have to fill out. Actually, there's one form that they have to fill out. And that form just kind of proves that they've had credible coverage up until the point that they go to Medicare. Now, that's actually a question, Steve, that we get a lot. There is a caveat in there. If you work for an employer that has under 20 employees, okay, Medicare is your primary health insurance. So what that means is that if you work for a company with under 20 employees and you're turning 65, you should really go on to Medicare, okay, with a supplement plan. Now, if you work for a company that has over 20 employees, okay, I spoke to a guy yesterday. He works for a huge company, okay. He can stay on his group plan for as long as he wants until he's ready to retire. When he does retire, okay, then he can transition to Medicare. But that is a key marker, Steve, that people need to realize. If you work for a company with under 20 employees, we should really take a long, hard look at Medicare. Over 20 employees, you don't have to do a thing. You can stay on your group health plan for as long as you want.
Got it. Got it. Okay. Okay, let's talk about some kind of key topics. So like, key mistakes or, key things that people should know. One of them I think, that I want to talk about is the whole concept of the um Part B premium, right? And certain things that people need to know about the 2-year look back and how you could potentially maybe make some changes there. Can you talk a little bit about that process of the premium and what options people have there?
Yeah, so Steve, that's where you and I work together with our clients. It really does not hurt to start having that conversation a few years out. With the tax planning that you and the team do, we could save our clients a lot of money off their Part B premium. Medicare, they look at your modified adjusted gross income from 2 years ago. And just to give you for instance, Steve, we talked about the base rate being 174.70. I'm going to tell you how quickly it scales up. The next rate is 244.60. Okay. Then the third tier is 349.40. So we're talking about significant dollars really quick. And that really, again, depends on your tax return from 2 years ago. But I can't emphasize it enough how important part of the process it is to really have open, honest conversations about that your income and what you can do to help your cause there.
Now, let's say somebody retired in 2023, so their income is certainly going to be different in 2024. Medicare is still looking back at their, prior year, their 2002 income to set their base rate, but there is an appeal process that somebody can
Yes,
request reconsideration. Can you talk about that?
you can appeal it, Steve. And actually, I don't know. I don't know exactly why, but a lot of clients have won that lately. Just imagine, a lot of people, Steve, who are making significant income at 65, and they retire, and with the right planning, they're still making good income, but there's a drop. You can contest that. I can get you the documentation that you need. You can contest your charge. What's really ironic, Steve, and a little funny, is that you could have $100 million in the bank. Medicare doesn't really care about that. Okay, they're just looking at your income. So again, with the right planning, I think you can really save yourself some money.
Yeah. Another key topic, Gary, that I know comes up a lot, and is a lot of times we have clients who are different ages, right? So we maybe have one, spouse who is 65 and eligible for Medicare, and maybe one who's not, right, and is not yet eligible. And a lot of times that plays into the decision of when and how to retire. What
Yep.
are the options out there for people if one spouse is eligible and one spouse is not?
Yeah. So generally, Steve, there's three options, and a client actually jokingly told me a fourth option last week. Here are the options. Okay, if your spouse is going to go on to Medicare, that's great. But you're whatever you are, 61, 62, 63. Okay, there's a couple different ways you can look at it. Number one, you can see if you can possibly COBRA onto your spouse's group health plan. Okay. We would look at the cost and the coverage, and that would factor in. Number two, we could go directly to a carrier for you, depending on where you live. If you're in the Philadelphia 5-county, Independence Blue Cross and Blue Shield is the dominant carrier. We would look at them. Their rates are strictly based off of your age, the county that you live in, and your smoker status. Okay. The third way is we could go on the Pennsylvania Healthcare Exchange if you live in Pennsylvania. If not, wherever you live, and we could see if you could qualify for a subsidy, which is a fancy word for a discount. Those discounts are based off of your household income, and it's at least worth a conversation. It's a couple of clicks to determine if you would be eligible for a subsidy. And the fourth way, Steve, the joke that the client said is you could go get another job with benefits. So they're really the three ways that we take a look for our clients to and it happens all the time, Steve, all the time. 65-year-old with a 61-year-old. But it shouldn't. People are so worried about it, rightfully so. But it's not nearly as overwhelming as what people make it out to be.
Yeah, I think the key message there is that there's options, right? And I think
Yeah.
there's more options than people are aware of. So sometimes we see clients that are just working until their spouse turns 65, and maybe unnecessarily, like maybe there's some affordable options that are out there that we want to make sure that they're educated on, so that they can make the right decision on time frame, not just driven by a healthcare decision. So I think
Steve,
that's important
yeah,
and overall.
all the time, Steve. I mean, that's a big part of our job, and and I'll tell you, more than half the time, we say maybe you should just stay on your group health plan. Um, so it's it's something that we do for all of our clients.
Yeah. Well, Gary, we covered a lot today. I'm sure we could probably spend another hour, 2 hours getting into the weeds and into lots of details and very specific situations, as every case is a little bit different. But I think our objective today was really to give folks, a lot of resources, a lot of food for thought in terms of what decisions need to be made, what options that are out there, and there's more options than people may have thought. And there is, good planning and some decision making that can go into that can help people in making this not such a stressful decision and really feeling confident in what they ultimately do choose. So, Gary, any last thoughts or last words that you want to share with the audience today in terms of things to consider or any last sort of words of wisdom?
No, Steve, I mean, when working with the Beacon Bridge team, and don't think any question is too small, or you just want to, explore some options. That's why we're here. Feel free to call or, whatever, text, email us, and, just for a little guidance, we'll help you out.
Yeah, we appreciate that, Gary. You've helped a number of our clients already and really navigate these decisions, and they're important, and so we appreciate that. And for the folks who are are watching here, again, we want to thank you for your trust and confidence you have in Beacon Bridge. Myself, all the advisors, and all of our team members here at our firm. Your total wellness is important to us. We are here as a resource for you, and know that no question's too big, no question's too small. We want to help you navigate these important choices around your overall financial planning, your total wellness, healthcare decisions, et cetera. So again, we thank you for your trust and confidence. Tune in for our next webinar, and please provide us any feedback on questions that you may still have, and any questions that we may need to go a little bit deeper on. Garrett, thanks again for your time. Thanks again for your partnership, and as always, we'll see you soon, I'm sure.
Thank you so much.
All right, Garrett. Good to see you. Take care.
Take care.